Hi, my name is Dr. Jeremy Height, and I'm with Pinnacle Chiropractic and Rehab in West Fargo. And today I wanted to discuss rotator cuff injuries. I think one important point to mention with rotator cuff injuries is the majority of these injuries respond very well to non-surgical care, meaning chiropractic, physical therapy, these treatment options work really well and we're able to get really good results if done correctly. So when I look at a rotator cuff injury, the first thing that I want to look at is how healthy are those rotator cuff muscles and that tissue. In a correct, healthy muscle tissue, tendon, fascia, what should happen is that tissue should be able to glide. It should be able to move across each other. We shouldn't have any restrictions if it's uninjured. What we see a lot of times is that muscle, the tendons, the fascia just isn't able to glide. It isn't able to move because it's been injured from a auto accident, from a sports injury, throwing, multiple different means. In our office, one thing that we have some specialized tools that we use to basically get into that fascia and basically break that up, take that muscle and that tissue from a non-moving state to freeing it up to get that moving again. The second thing that we look for with rotator cuff injuries are can these muscles absorb the load? Meaning if we go reach into the cupboard, if we're putting our coat on, if we're throwing something, our muscles should be able to, lift that weight, and it should be able to lift overhead. It should be able to grab that out of a cupboard. If our tissue is not able to basically absorb that load, what happens is we get pain with those certain aspects in those certain movements. So one important point of treatment is getting patients on specific exercises with specific weights to basically slowly load those tendons in different directions. And as patients are able to absorb more into that tendon, their pain decreases and they're able to do more and more. And we're typically needing to do this in a progressive fashion, meaning we start with a 3-pound weight if they're not able to do it, and then we work our way up to 5 pounds and then 8 pounds usually from there, and patients are doing pretty well unless we need to kind of get into some throwing motions or something a little bit more dynamic. So follow along next week. I'm going to go over the specific exercises I like to increase the load of these tendons and get that shoulder to a nice, healthier spot. Have a good rest of your week.